Hello, I'm Lisa McNeil from the UK. I'm a patient with bronchiectasis. I'm also a patient advocate and the chair of the Aspergillosis Trust. Sadly, I believe that one of the biggest barriers to diagnosing bronchiectasis is that so many people become used to feeling unwell. A chronic cough, repeated chest infections, exhaustion, breathlessness. These things just slowly become part of everyday life, both for patients and even sometimes for the healthcare professionals caring for them. I speak to people every day who tell me that they had spent years being passed from one appointment to another, treated repeatedly with antibiotics, just told it was their asthma or a repeated chest infection, without anybody actually ever stepping back and asking, why does this keep happening? So that by the time the patient finally receives a diagnosis, they're often physically exhausted, emotionally drained, and living with damage that could have been prevented. I also think that there's a real feeling of invisibility with bronchiectasis. Many people don't look obviously ill, but they're managing daily symptoms that can completely change the quality of life, whether that's daily airway clearance, a chronic cough, repeated chest infections or fear of them, hospital admissions, the feelings of isolation, and the constant uncertainty of not knowing when a flare-up might come. For patients living with aspergillosis alongside bronchiectasis, the journey can be even more complicated. Symptoms overlap, diagnosis can be missed, and many patients just feel like they have to fight to be heard and to be believed. Access to specialist care is another huge issue. Many patients don't have access to respiratory physiotherapists, specialist bronchiectasis clinics, fungal testing or multidisciplinary teams, and that inequality can really affect health outcomes. But what I've learned through the patient community group is just how life-changing the right care actually can be. When patients are listened to early, properly diagnosed and supported holistically, it doesn't just improve their health, it restores confidence, it restores independence, and it restores hope. And that's why raising awareness of bronchiectasis and listening to patients' voices matters so much. Earlier diagnosis and better coordinated care can genuinely change lives.